Hello, I am Dr. Manjunath Malige. I am the Chief Endocrinologist and Diabetologist at Aster RV Hospital, JP Nagar, Bangalore. In my day-to-day practice, the vast majority of my patients are those who have diabetes. Given the recent corona scare, I thought I would connect with you with some of the important tips and answer some of the commonly asked questions in the clinic about diabetes and coronavirus. Let me start from the most common question that is asked in the clinic. The question is there an increased risk of infection and complications of coronavirus infection in patients with diabetes? Now, there are two parts in this question, risk of infection and risk of complications. The answer is a no for the first one, which means diabetes patients are not at any higher risk of catching coronavirus infection compared to general population or non-diabetic population. On the other hand, the risk of complications after they have caught coronavirus infection is definitely high. This is the reason why it is important that people with diabetes understand what they need to do should they have a coronavirus infection or a suspected coronavirus infection, because the complication rates are high and in some unfortunate situations it can also lead to death. I will share with you a slide which will actually show some important information. As you can see, the topmost bar, the horizontal bar, shows that the risk of complications and the increased death rate is particularly high in those who are 70 years and above in age. Now, this also includes people with other medical conditions, particularly diabetes, kidney failure, chest infections, bronchitis, people who are on steroids, etc. So, it is important that we realize that there is no greater increase in the risk of infection due to coronavirus in patients with diabetes, but there is certainly an increased risk of complications due to this. The second question that I get asked frequently is whether we need to change the medications in view of the possibility or the risk of coronavirus infection. The answer is not really. If your diabetes is well controlled with whatever medications you are on, either tablets, insulin, or a combination of tablets and insulin, and if the blood sugars are under reasonable control, there is no need to change any medications. It's as clear as that. The third question I get asked is, do I need to monitor blood sugars at home? I think it would be a good idea to monitor your blood sugars at home, particularly if you think that you have flu-like symptoms like running nose, sore throat, high fever, dry cough. Because the first thing that happens in your body should you have an infection is the body produces the hormones that help your body to fight the infection. And these hormones, typically adrenaline and cortisol, increase the levels of your glucose or sugar in the blood. So it is important that we do some sugar monitoring about 2 to 3 times a day and see what the sugar levels are. We usually say a good diabetes control means a fasting blood sugar of about 90 to 125 and 2 hours after food blood sugar of about 140 to 170. Give or take 5 or 10, that's fine. But if you have any flu-like symptoms or if you are unwell, it is important you monitor the sugars with a glucose meter at your home twice or thrice a day. And if the sugars are consistently running high, seek immediate medical help. The next question I get asked is what to do if my blood sugar monitoring at home shows that the blood sugars are high. Well, this is exactly the situation where you need professional help. If that is the case, I suggest you come and see us. And if it is out of hours, please come into the emergency department and our team of doctors will do the needful. If you are running high blood sugars, then there is a good possibility that you might have an infection which might need particular attention. And high blood sugars themselves can put you at risk of other complications of diabetes called as diabetic ketoacidosis, wherein the patient becomes very unwell, sick and dehydrated. You may need IV fluids to keep your kidneys well. So if your blood sugars are high, please seek immediate professional help. The last question that I get asked is, What do I do if I become unwell or sick while at home? The answer is the same. Please seek professional help immediately. We need to know why you are unwell and sick. It could be due to coronavirus infection, it may not be due to coronavirus infection, but it is important that you come into the hospital, to the emergency services or to the clinic and get yourself checked, because those people who are on tablets might need insulin temporarily if the blood sugars are high, and those people who are already on insulin might need a different type or a dose of insulin to tackle the high blood sugars. I'm glad to say that at Astra RV Hospital and in the Department of Endocrinology and Diabetes, we are fully equipped to tackle the complications of diabetes and coronavirus. We have a full-fledged team with all the state-of-the-art technology and the manpower and the international skill set to manage complications of diabetes and coronavirus. Should you need any help, please do not hesitate to contact us. Thank you for watching.